here. Once you really have dementia that has actually impair you, you're going to have a problem understanding concepts, communicating concepts, appreciating how much dementia you have, and reasoning. Those are the four.
What's the last one?
Reasoning, judgment. So when I do CME, like certificate of medical examinations, to ask for an 85-year-old who needs a guardian, we're looking for that. Can he communicate? Can he understand? Can he reason? And can he appreciate the level of his understanding? So hearing, that is an important one, because how can you remember something you've been told if you cannot hear it? Right? So hearing goes with age. But hearing, like it's happening to my dad, isolates you. Because, why am I going to go to the cafeteria if I cannot hear the conversation that I'm having with someone? And then you start just watching more Fox News. Right, because you don't have to do much. That's the difference. That's the difference between watching TV and doing something. That these kids with ADHD, now everybody, all these kids have ADHD before. I didn't have ADHD, but I have a sandal in my butt when I was misbehaving, right? But they didn't call it ADHD. So I tell the parents, instead of letting those kids just be, they have ADHD, they cannot pay attention to the teacher, but man, you give them a computer and they can be playing games for 24 hours. So what is the attention? What is the lack of attention? They can pay attention for sure there, right? So how do we treat that? Giving them a bike, because the bike doesn't drive itself. You have to drive the bike. You have to make decisions with the bike. A computer just gives you what the computer has. So the same thing applies to dementia. If you start declining cognitively, the first thing that we're seeing is the person's personality is changing. Now he's more depressed. He looks like with less energy, right? So what do? You just sit down and watch the same news over and over and over. So your hearing goes down as the TV volume needs to go up, but then you start isolating yourself because you don't want to go to the cafeteria, you don't want to go and hang out, you don't want to do the things that you used to do. So then the lack of hearing impairs you more and you look more demented because you're acting more demented. Does it make sense?
So in connection with that, missing some of the words in the conversation.
Mm-hmm. Missing the words, yeah.
So they don't, a long sentence doesn't hear the whole sentence.
Right.
Doesn't understand it. And you combine that with hearing aids, and that's the problem I'm having. Not mine, but
Right. Right. So that is true. What I said before is you cannot remember or recall things you have not paid attention to. Why? Because you didn't hear it. So, but that's why we don't only test for what you get through your ears, but also through your eyes, right? That's why I give you 10 words to remember, and I make sure that you hear them. So you're hearing those words. How many can you repeat? That's memory, not a hearing problem. But if every word I say, you say, what, now I know it's a hearing problem. Right. So we have a way to test for that. And of course, if you don't hear some of the messages, I don't know if you understand them or not. Understanding is different. Right? I can explain something you can say on your own words. So that will be understanding. Any other questions? Yeah, I can test for that. Yeah. I make sure that you hear. I make sure that you see. Because I want to go past the hearing issue. I mean, if you say for every word that I say, you say what, then we might just have to just test for something that is visual. Something that is done with your eyes.
seeing, hearing, verbal communications, and all that. What are your chances that, I guess what I'm asking for, if you've got dementia really bad, what's the life expectancy?
Oh, okay. Yeah, I get that question a lot. I just hate to play God on this because I don't know. The question is, what is the life expectancy in like Alzheimer's dementia, right? Right.
Now, she's got frontal temporal
Oh.
lobe dementia. She has no Lewy bodies. We've gone through 2 PET scans, 4 brain scans, 3 MRIs, a spinal puncture.
Right.
And they don't, all they show is that she has no plaques, but she has frontal temporal lobe dementia.
Right. So he's asking, after many MRIs and the rule outs of Alzheimer's, the rule outs of vascular, that she's got frontotemporal dementia. Frontotemporal dementia usually starts very young. The one that is genetic, I've seen people start in between 45 and 55. What happened also is that because of age, the brain, there is a normal cognitive decline and there is normal brain decline. So if the brain is declining in the front, that can form a frontotemporal dementia. But you have to rule out through PET scans and MRIs. You have to rule out that there is plaque. The plaque is not coming up anymore. It's been deposited. So you rule out with MRIs, PET scans, functional MRIs. Now we have all these nice pictures of the brain. At the end of the day, it's not what the brain looks like. It's what the brain can do. So once the person, that's another thing, once the person has dementia, I always recommend that the person names, before it gets that worse, someone to be like a POA, like a power of attorney. So I know most of you that I know, have your kids or the spouse. Be careful with the spouse, because then you once get dementia, you're making decisions for the one who is getting dementia, then that's a problem. So the kids are best, right? Especially when it comes, sell a house or take away the car and things like that. So be careful. It's okay to be POA of your spouse, but that's another thing that I want to bring up. It is so hard to see. It's not as hard to see somebody decline, but the other person taking care of this one. Because one doesn't have dementia, and this one has dementia. And the spouse is just having all these stressors. Why? Because you just become a babysitter, right? So you have to take care of yourself. Ask for help. Like no babysitters, what do they call it? Sitters, like home health care. Something that can help you just, get in the car, go free your mind from the pressures. Because people with dementia will fall. Why do people with dementia fall? You asked me before, right? Like, dementia has to do something with my legs. No. But what is the one thing older folks die from? It's called sarcopenia, loss of muscle mass. We die when we lose our muscle. So my mom in Spain, she's 79. She still runs the half marathons. She doesn't run. She walks fast. And there's always a police car behind her, because that's the car that closes the track. But she doesn't care. She takes 4 hours. She just goes. Right? There's always a car with the flashing lights. It's so funny, because she's always the last one. But she's the first. She's number one in her age range. So she's always a gold medal, but she came last. We have so many pictures of that. So what does she do to train every day? She does this. No hands. She sits. She gets up. She sits, and that does it like 40 times. She's creating muscle in their legs. If you go to Planet Fitness today, these dumb people that are 30 years old, all they're working is their muscles on the top. Like they're gonna walk on their hands when they're 80. Right. Right. It's like the legs are forgotten. So they have these skinny legs and they're walking like this, right? So I tell my mom, sit on the ball. And then she sits on the ball and she does the balance thing, which predicts Alzheimer's. She gets up, she puts some weights on her hands, and then she gets up and she does it. And then she runs every day like 7 kilometers, like 5 miles. So work on your legs. Because once you lose your legs and go into wheelchair, now we're in trouble. Then we lose. Some older folks, they just okay one day and then they lose their legs. So and then the cognitive decline comes in. What predicts? So let me give you a little bit of history. 2003, I'm doing my dissertation. And I look at these Finnish studies from Finland. And I'm doing my dissertation in Dallas, so we have these little mice. And then we're giving them the plaques and the tau and all this. And we look at the plaques of Alzheimer's from underneath, right? And all we see is glucose receptors. Glucose receptors that need a lot of insulin. Like, wow. And then we put that as a further studies need to be done. If you Google today, type 3 diabetes, you know type 1, right? The one you put insulin. You know type 2, right? The one you take the metformin. Have you ever heard of type 3? You heard of it, right? So if you Google today, right now, right, there's 1 and 2. If you Google type 3 diabetes, the research shows Alzheimer's disease. So now we have a link in between Alzheimer's and all this glucose that we are eating every day. So it's an insulin resistant problem. So it's almost like a type 2 problem. So we see all these plaques being just, and then we've seen that with people with a lot of Alzheimer's. They say, oh, this food doesn't taste anymore because it's not glucose. But man, they can eat that cake that there's no tomorrow. Right, because it's glucose. Because it's the brain asking you to eat a lot of glucose. So it's an insulin resistant problem. So what happens with an insulin resistant problem? We don't create muscle. So please hit the gym. Move every day. I've seen many of you just walking your dogs outside. Just do something as much as you can do. Don't fall. But do as much as you can. Sit in the chair. Get up from the chair with your arms. You guys have PT here, right? Or it's like a gym or something. Swimming. Oh my gosh, I wish I would like swimming. I can barely swim. But swimming, because you're using your whole body. You're creating muscle. You prevent loss of muscle mass. Yes, sir?
You guys describe normal pressure hydrocephalus.
Okay. Describe normal pressure hydrocephalus. So, this will be this one, right? Okay. So, is the imbalance of the fluids in the brain exchanging back and forth? So, in the ventricles in the brain, you're going to have fluid, right? Because the brain has to have fluid. I mean, you can, if you do like this, you see how the brain is gel, and then it goes back and forth. It has to have fluid. It's not dry. So when the fluid in the ventricles is much more than it should be, you might develop normal pressure hydrocephalus. So it's water in the brain. So symptoms: headaches, confusion, disorientation, and for some reason you cannot hold your pee. You start just peeing on yourself. So that is when you gotta hit the neurologist, right? And he's got a lot of have to do. I mean, you can treat it, but it has. I've seen the hydrocephalus being related to Alzheimer's shrinkage of the brain. If you maintain the same fluid, but you shrink in the brain, you have less brain. So now you have more fluid. So that exchange. And it happens quite often. We have some folks here with that. But you can treat it. Yeah. It's just doing surgery. For the younger folks, they do a shunt. They put a shunt inside the brain, inside the ventricles, and then you have a drip down to your stomach, right? So you can regulate how much fluid your brain has in the ventricles. But operating in older folks is, brain surgery. Imagine that. Yeah.
How much information does the doctor get from an MRI
How much information the doctor get from an MRI?
regarding dementia?
Zero.
Zero.
Zero. An MRI. How much information you get from someone you took a picture? You just look in the outside, so everybody's happy in the picture, right? But you don't know what they're going through. It's the same thing. The MRI might tell you that the brain is shrinking. It's called loss of volume, right? The MRI might tell you that the brain has some areas in which the brain had a stroke. But still, people with a stroke can still function. I mean, how many had these small strokes and they still can function? I think the assessments that we do tells you how the brain works. It's not so much how the brain looks like. It's like what the brain can do. We don't know our brains here. I mean, not too many people have looked inside.
Yeah, well, what about the little 10-minute test that the doctors give?
Right. So the 10-minute test is usually a mocha or slums. I don't do those. I do the whole thing. I mean, I know some of you have been with me. So it takes 3.5 hours because I'm going to test every area, but I have to have a baseline. So that's another question. How do you know if I'm losing memory if you never seen me before? I have a baseline. What is the baseline? I do a test on you that tells me how much intelligence you had when. Do you mind sharing how far do you go in school?
BS degree.
A bachelor's degree.
Yeah.
So your bachelor's degree, you end up around 22. You were done with it, right? 22, 23?
No, I was in my 40s.
In your 40s. Okay. So I can predict your intelligence when you were in your 40s today by one test. Then I compare that test to how much memory you have left. So let's say that the test tells me that your IQ is 110. So you are average to high average intelligence. And then your memory is a 70. Well, we have a problem here. You're dropping something. But if your memory is average, then it equates to your IQ. So I know there is not a decline in memory. But I test memory, language, visual, spatial, visual memory, motor abilities, the whole thing. So that's how I know.
Okay. Because my concern is the neurologist, we went to did an MRI and then the 10-minute test and then diagnosed dementia. And it's like,
It's wrong.
okay,
It's wrong. A 10-minute test, you're talking about the mocha, the 30 points.
yeah.
Right. So what day is today? Can you remember 5 words? Can you count down from 100 by sevens? Can you tap when I say the letter A? How is that telling me you have dementia? If I don't ask you about, do you pay your bills? Do you still drive? Do you still know where your room is? Do you still know the name of your husband? Do you still know the name of your kids? Do you know how you got here? You know, how long ago? Those are the real questions. Oh, wow. These never...
What if you get 19 out of the 30?
Right. If you get 19 out of the 30.
Pretty bad.
No. It still doesn't tell me, if you get 19 out of the 30, still doesn't tell me whether you have dementia or not. You might have a cognitive impairment, but we need to see which you missed. But that's a great question, because if you get a 1 out of 30, that doesn't mean anything. That means that you were not even paying attention. So in my testing, I have to do effort testing. I have to do validation testing. I do a lot of forensic work. And people will fake. People will fake to look worse so they can sue the trucking company for having that accident and that traumatic brain injury. So I have to do effort testing. So I do effort testing with you. So I don't know why my phone should never do this. I'm sorry. So I do. So 30 out of 30. Remember when Trump said? I remember that one. He said, "Oh, I'm smart because I get 30 out of 30." Well, it doesn't measure IQ. It measures that you know all the questions, but it doesn't measure anymore. It's still with 30 out of 30. If you had an IQ of 130 because you have a master's degree or doctoral degree and then you were so smart, 30 out of 30 is a good score. But what if you forget when you're driving where you're going, but you still have 30 out of 30? You still can have dementia. 19 will worry me. Why? Because you're there, you tried to do something, but you didn't do it to the 30. So then that neurocognitive screening is a screening. It's not diagnostic in nature. We have to do the full test to see what are your cognitive deficits and whether those cognitive deficits coincide with what? With some type of dementia.
Where can I get this test?
Done? I can do it.
That's the question. How do we get to you?
Oh, to me. Yeah, he knows. Yeah, goes the bridge. We have a clinic here on Fridays. Dr. Gibbons comes here every Friday, right? Well, when she's not out of town. So then she's a primary care physician. But what we have done before also, if you have your PCP somewhere else, then you can come to us. That's not a problem.
We have a referral to you.
Yeah,
Personally?
I think so. I think how it works. Jessica knows that. The lady that sits in the front, just ask her, and then we can do the testing.
And how long does it take to get to you?
Yes.
I have no idea. I'm busy. I have no idea. But we can always schedule it and then do the testing. Yeah. Have breakfast that day because the test is like, I get tired. Imagine you. That's a lot of questions. It's probably like 250 questions. I think. Yes, sir.
Yes, so it kind of seems like we should be tested at some point because we need to know whether any of this stuff is happening.
So, I mean, to tell you the truth, I tested my parents when they were 70 just to have a baseline. And now I test my dad, he's 80 now, and he scored the same thing. So I know he hasn't gone down. I don't think it's a bad idea, but you have to have a medical reason to test. So because it's not predictive. If you come to me and you have no symptoms, you're giving me a good story. Right? You're not confusing how many times you've been married or how many kids do you have, or then there is no reason to put you through a 6-hour test and then diagnose you with normal cognitive functioning. I'm not so worried about memory. I'm worried about how you're driving. I'm worried about whether you're paying your bills on time. I'm worried about how you navigate socially, where you feel depressed. So one question I would never miss here is, were you involved in war? And that's another thing that I want to bring. You see that one where it says pseudo dementia somewhere here. Pseudo dementia. Pseudo. What does pseudo mean? Fake. Fake dementia. So imagine all these kids now, they're calling veterans, and they're like 23-year-olds. It's like, when I look at a veteran, I look at somebody older, right? But these veterans that went overseas to Afghanistan, these kids, they came back with symptoms of dementia. I said, you don't have dementia, you have PTSD. So if you have a mental illness, PTSD, depression, anxiety, because you've been in war, because you've been involved in all this, witnessing all these traumatic events, you might look like dementia, but you have depression. So pseudo-dementia looks like dementia, but it's actually depression or PTSD. I mean, imagine you have PTSD and you have nightmares every night, and you're not able to sleep, and you come to me for a 6-hour test, and you can barely open your eyes, and yes, your IQ is going to be 120 because that doesn't move, but your memory is at 70 because you're tired. And I say, oh, you have Alzheimer's dementia. No. I have to rule it out that you slept well, that you have good breakfast, that you have not had a stroke, that you don't have seizures. I mean, if you have seizures, history of seizures, your brain is slower. So I have to know all that. So to answer your question, if you come to me with no complaints, why would I have to put you through a test? You're good.
But for the most part, we have some sort of
Mm-hmm.
We just don't know where we are
Yeah,
on that map.
fair. Yeah, I'll do the test. Fair.
So we start with our primary care physician.
Yeah. Yeah, if you're having problems with memory or attention or sleep, the nightmares, that's a big one. I mean, if you go to sleep thinking you're going to have a nightmare, you're not going to sleep well. Folks, sleep well. Sleep well. Because we see in Alzheimer's dementia the sundowning. Everybody knows about sundowning, right? It gets 4:30 and then agitation, irritability is because melatonin doesn't work in your brain anymore. Your circadian rhythms are off. And older folks look like my daughter when she was 4, and she was crying at the end of the day. I said, why are you crying? Are you sad? No, I'm tired. We'll go to sleep. We don't cry when we are tired. We go to sleep when we're tired. We cry when we're sad. But we get tired, and it's called sundowning. And it's terrible.
Does the sundown stay with you?
Mm-hmm. When you have Alzheimer's, special Alzheimer's, and Lewy bodies.
5 o'clock, that's the best I can do.
Right. That's it. And now you can stretch it a little bit, 5:30, because we went spring forward. So 6 o'clock and we are good. Right. And some down, they just get tired, they go to sleep, but some of them get agitated. I mean, restless. They start walking, they don't know where they're going. It's just the brain not working. So we have to address that. That's when you go to your PCP and get some trazodone and melatonin.
Put them to bed at 5:30, wake up at 1 o'clock in the morning.
I know.
They start wandering.
Yep.
You have to make sure every damn door is locked and every window is locked, or you're in trouble.
Yeah, you know what you're talking about, and that's why I'm saying those folks have to have that support system built in. Wear you down, because now you went from being a husband and a companion and everything is 100% everybody is giving to just you giving it all and taking care of someone who cannot take care of themselves. That's when you have to start rethinking stuff, and I know you are. Question? Yeah.
Just briefly address the use of antidepressants in dementia, because so many of the things, it's like depression makes it worse,
Yeah.
but it's not the underlying, it may or may not be the underlying cause.
Right. Like, yeah. So antidepressants, Celexa will be one of them. So here's the thing. When we go to school, we learn how to prescribe. So it's like in my opinion, the doctors have been given, and I'm not going to say that they don't work, but the doctors are given one hammer, and they treat everything like a nail. Doesn't matter, boom, 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 nail and everywhere. Why? Because that's the only thing that we do, right? Prescribe. If you have Sundowning, Seroquel, and Trazodone, and Zoloft, and depression, and all that. So we try to stay away from giving medications. Why? Because first, they might not remember to take them. Second, they might overdose. Third, our metabolism is getting much slower, so now the medication stays longer in our system. So why are antidepressants like SSRIs good? Because if you take twice the dose, you don't likely you don't overdose. If you don't take it, it's okay. So we have to look at the behavior. Is the person depressed, or is the brain being depressed by the disease? Because there's clinical depression, something happens and you're depressed. Another thing is the brain shrinking, so you have less to do every day because you have less function. So you look more depressed. So what are the symptoms that we're trying to treat? That's why my treatment goes more, are you sleeping well? If you're not too depressed, if you're not too anxious, are you sleeping well? Are you eating well? Are you exercising? What is the best antidote for anxiety and depression? Exercise. Because you cannot have both. People who are depressed, they're not exercising. They're being depressed. So, if you come to me and you say, I've been taking, 25 of Zoloft for the past 20 years. Well, please taking it. But the Xanax, oh my gosh, no, please. The Xanax, all those medications, it'll be so hard to get off of them. Like the anxiety medications. There's other things. So antidepressants like Zoloft, Celexa, Lexapro, Prozac, Paxil, all those work for anxiety better than Xanax. In Xanax? Or on Xanax? On Celexa, you're fine. I think you're fine. Celexa is kind of like the, all right, just take it. No. I haven't seen that. Never read that. Especially Celexa and Lexapro. They're good molecules. They curb anxiety. It's not like they're gonna get you out of depression. Antipsychotics will get you out of depression and major depressions. But they curb, like Zoloft in the older folks. It curbs that anxiety that you might have. But psychotherapy is a good thing too. You just go talk to a counselor. Just tell them about your life. Tell about your secrets. Anything that is hurting. Pains, hurts, and hang-ups. You want marijuana, don't we all? Yeah. Right, talk to the bartender. All right. So, yeah. Any other questions?
How much does socialization play into this?
A lot. A lot. Just push yourself to do new things. Like, she had her bachelor's degree at 40. That means she's driven. She wants to do something. Socialize. Oh, sorry. The question is how much socialization will play a role in dementia. I mean, if you're still socializing, that's good. Italy and Spain, less incidence of dementia, they believe, is not because we take naps, but because we socialize.
That's another thing I was going to ask about naps.
Naps, great. Shot of coffee and a nap is the best. Yeah, because then the shot of coffee will put you to sleep right away, and then it wakes you up in 20 minutes. So it's a power nap, right? Just don't nap until 5 and come to me and say I cannot sleep at night. Well, you've been sleeping during the day. Yeah. Napping and partying, yes. Depends on what kind of partying. So, question, what do you think predicts, and this is the hope question, what do you think predicts longevity? Genetics, happiness, attitude. Those are indexes. Those are indexes within the one I'm looking for. Exercise, movement. Keep moving. Don't fall. So all those are small indexes that one gets it all. You never thought about it. Relationships. Oh yeah, socialization, exercise, diet, education. All those are comprised in one. Your zip code. Let it sink. Think about it. Let it sink. Let it sink for a second. Your zip code. Let it sink. What does your zip code says about you? Even though you might have moved because you guys move so much, right? But you always kept a zip code. A quality of zip code comprises what? Level of education, socioeconomic status, jobs, money, better cars, better things. So you are prone, if you put a lot of health into it, to last longer because you have better quality of life. If you're making $1,000 a month and you have 3 kids, you cannot afford a membership to a gym. So now the exercise goes away. And now we see socioeconomic, low socioeconomic status folks that are what? Obese. We never saw that. We see the more obese people and people that have less resources because they're eating sugar every day, because they're obese, because they eat sugars, glucose, carbohydrates. They cannot afford the steaks that you can afford, the protein. Right. So the zip code predicts how long you will last. The whole world. Look at from the north to the south. South American countries, much poorer than the North American countries. Africa versus the north of Europe. The zip code. The north of Chicago, much better than the south of Chicago. North of San Antonio, better than the south of San Antonio. So the zip codes overall will predict how long you will last. But then you guys live here. I don't see in other assisted livings in San Antonio folks y'all's age that are as good as y'all are. Why? Zip code, activities, economic power, education. Most of you have master's degrees. Most of you are lieutenants, captains, generals, and all that, right? So levels of education, exercise. So you have an opportunity to last long. It's the quality of how we're lasting, right? But some of them, like in the Oaks, they get the Alzheimer's, dementia, and yeah, that can do much about it.
But it's not so much the quantity of water, it's the quality.
It's the quality of life, right? Zip code will give you quality of life, which might give you then quantity, right? It's the quality of life. It's how you get there. I tell my parents, now is when we have to fine tune your health. When we were 20 and 30, well, let's drink a party. Well, another joint, right? But now you're 80, you are this close to a stroke and get mom in trouble. So you better take care of yourself. And mom, you're this close to falling in one of those races that you don't have to be doing. You just walk around the neighborhood, stop the marathons. Because my dad will not survive with my mom after 60-something years together. He will not survive. I think he'll throw himself in the hole with her. So it's crucial to take care of yourself. And those who are caring for those who have dementia, take care of yourself. Take care of yourself, man. Because it'll bring you down. Yes, sir. Plaque. Like in your teeth? Nah.
Any way to reduce it or reduce the amount that's building up?
No. No. There's this new medication that what I see is like it scratches the plaque off, but then it scratches the vascular system too. You cannot, because I told you this amyloid plaque start coming up like at 40, 45. So it builds up, but the body is able to just get rid of it. But at one point, you don't get rid of it. So it forms tau, which is neurofibrillary tangles. And then the neurons start like switching off. So, I mean, we have those medications, Aricept and Amenda, and we have seen that we can slow down the progression. Right? Without the medications for dementia, Alzheimer's dementia, without them, we see this, right, decline, 10 years, 15 years. With them, the quality gets better, but then 10 years, 15 years. So the same amount of years, but the quality is better. That's what I've seen in 25 years with doing this. Yeah.
What's the prognosis? What is research showing?
Uh-huh.
Is there going to be a cure?
Uh-huh. No. Now, one thing you have to think is that life is fatal. Yeah, yeah. That is the research shows that 100% of people die. All of them, except for Jesus. But yes, all of them.
What about all these advertisements you see that come across your phone, your
Mhm.
computer about,
Right.
oh, take all these herbal things.
Mhm.
Take all
Yeah.
this is cured in 2 days.
I'm on those. I'm on those medications. Not medications like NAD plus, glutathione for the liver, and curcumin, resveratrol, all that. But I have never had alcohol, so I don't drink. I never drank in my life. So I think that helps to be healthier. I exercise, so it helps be healthier. I stay in a zip code that I can afford, so I stay healthier. So, but at some point, we're all going to decline. Some people decline gracefully. You know, I see a lot of age, and I know some of you folks that I have tested is like, hey, you know, you don't have dementia, you just have the normal age decline that we see. So, yeah. But, go ahead.
I think what she was asking was, does Prevagen help?
No,
No.
no, they're taking your money.
That's right.
I mean, no. But if Prevagen has helped you, then continue to take it. I'm not against it. Whatever helps you stay. Even if it's placebo, if it is placebo, take it. Good placebo. But don't spend. Now what I've been doing, and I feel a lot of energy, is the IVs. You know. When we take vitamin D3 or B12, you know, it breaks down in the stomach, so we get like 15% of stuff that we take. So an IV, you get the whole thing. You just put an IV. So we hydrate well. So if your PCP thinks it's a good idea for you to get an IV with all the B12s and the D1s and the D3s, and what I've seen also is people get drunk on Saturday night and they go do an IV on Sunday. So they can clean up their liver. Well, it doesn't work that way.
We used to give older people vitamin D shots.
Yeah, B12.
Yeah. And go on and give them energy.
Right, and it's an antidepressant. Yeah, and D3.
D3 only works with K, though.
That's for your heart. Yeah, that's good. So you're plaque in your heart. K2 and D3. D3 was the best predictor of COVID. That's crazy, because the best predictor of COVID severity was D3. D3 better than 30 was COVID will get, mild COVID. In between 30 and 20, people will get moderate COVID. And then less than 15, people will get COVID that was so severe, some of them died. So what predicts COVID? What predicts having D3? How do you get D3? In the sun. Sunshine. We get the sunshine. If we have enough white skin, it'll get better. But what? No. You can still metabolize some. The problem is during COVID, they tell us to stay inside. So we don't get sunshine.
If you had a stroke, does that necessarily mean you're at risk for dementia or Alzheimer's?
If you had a stroke, is that a predictor for dementia of Alzheimer's? Or Alzheimer's. But dementia of Alzheimer's. If you had a stroke, the predictor is vascular dementia. It depends on when you had it. But the more you had strokes, we have to see what is the cause of a strokes. Is it because you have a lot of plaque? Is it because you have a genetic predisposition to have a stroke? Is it because you're smoking, you're drinking, you have diabetes, hypertension, hypercholesterolemia? Control those factors and stop the strokes. But if you have a stroke at 70, 75, vascular dementia will hit you because you will not recover within the 2 years of recovery time frame. If you have a stroke at 25, hopefully it's not a big one.
Vascular,
Mm-hmm.
it's not repairable,
Right.
are you at risk for dementia?
Yes. So if it is vascular, is it repairable? Are you at risk of dementia? Yes. At 70, 75, 80 years old, if you have a stroke, the major risk is you die. But then, how many of those cognitive things have you lost from the stroke? Can you still pay bills? Can you still drive? Can you still see, to drive? Can you still function? And I have now gotten into the activities of daily living, such as, can you do your own toiletry? Can you do your own dressing? Can you do your own, all those things? Right? Because I've seen folks in dementia in the nursing homes in San Antonio, they just look at their socks and they don't know how to put them on. The recognition part is just like, so they open the drawer, they look at the socks, they put them back, they close the drawer, they open the drawer, they have all this rummage thing. They have the repetitive behaviors. So the socks never end in their feet. Or the shoes, the right on the left on the right. So, yeah.
What services does your practice provide that helps those with dementia and the caregivers?
So, what services do we provide in our clinic? We have Dr. Gibbons and Derek for primary care physicians. And then they have me for psych and neuropsych. We have Carrie for the psychiatric medications. We have now someone for counseling that she comes to the assisted living. Not on the what is the other side? Lakeside. Not Lakeside, but they come to the Crestway. Thank you. Crestway side is for right. I'm losing it. All those names.
Have you ever tested?
Yeah. No. Please no. So yeah. So we have counseling. So we have the counseling, the psychiatric medication. They have me as a neuropsych, and then we have Dr. Gibbons. Yeah. I think counseling does well. Just talk about your problems in a very safe environment. I like it. I think it's useful. Any other questions? We got 2 more minutes. We got 2 more minutes. Thank you. I can come back. I'll tell Lucy. Yeah. Thank you. Comfortable bed. She's asking about recommendations for sleep. So, do not eat after 6. If you go to sleep around 9 or 10, turn off your darn TV because it's getting in the way you're sleeping. Because still, you might be sleeping, but then you're going to get up and say, oh, I didn't feel like rested. Well, your brain was still listening to Fox News. Don't get me started on CNN. Imagine that, the nightmares. So, do not drink at night, because this is what the liver does. The liver stops all processes of digestion. Stop, because it's got alcohol in the system. Process the alcohol in 2 or 3 hours. And now it's 10 o'clock. If you drank around 7, it's 10 o'clock, and your body starts processing your food. So now you're digesting until midnight. How do you go to sleep if you're digesting? Sound, you want to get up, restroom, you want to go pee again. So that gets in the way of sleep. We take sleep for granted because it's so easy, right? You just go to sleep. We have to force ourselves to sleep. Exercise. Do not alcohol every day before you go to sleep. And I know some of you guys like to have the glass of wine or 2. Mental stimulation is good during the day. Sleep. That's the key. All right? Thank you very much.